Did you know that, according to statistics from the National Institute on Aging, more than 60% of men over the age of 60 experience issues related to the prostate, but fewer than 30% of them truly understand what is happening inside their bodies? Have you been waking up frequently at night to go to the bathroom, noticing a weaker urine stream, or simply feeling like you no longer have the same vitality you once had? If you have ever thought, maybe it is just because I am getting old, please pause for a moment. Your body has never given up on you. It is simply trying to send you quiet signals asking for help. In today's video, I will share with you a simple but effective personal care habit that may help cleanse the prostate, balance your hormones, and restore your vitality in a completely natural way without medication or expensive treatments. If you are over 60, please watch this video until the end. It might change the way you care for your health every day. What country are you watching this video from? Please leave a comment below. And do not forget to like and share it with your loved ones. This could be the most meaningful gift of health. The prostate is a very small organ in the male body, about the size of a walnut. It sits just below the bladder and surrounds the upper part of the urethra. Though small, the prostate plays an important role as a kind of biological factory in the male physiological system. Every day, it produces a special fluid that helps nourish and protect the biological cells unique to men. The prostate works almost silently throughout a man's life, but it becomes more vulnerable as we enter middle age. Just like a factory that runs nonstop, if it is not regularly maintained and cleaned, the internal ducts of the prostate can begin to accumulate old fluid. This slows circulation, causes blockages, and leads to various uncomfortable issues in daily life. Early signs, such as frequent nighttime urination, weak urine stream, or interrupted flow, are clear warnings that the factory is starting to experience problems. Unfortunately, many people assume this is just a natural part of aging and either ignore it or simply endure it. In reality, the prostate still has a strong ability to recover if we know how to support it in time. The good news is, you do not need expensive treatments or complicated procedures. With just a few simple care habits, the prostate can naturally regulate itself, cleanse internally, and restore its function. In the upcoming sections, I will help you understand why the prostate becomes overloaded after the age of 60 and why even a small change in your daily routine can help release the pressure on your entire hormonal and urinary system. Imagine the prostate as a complex system of internal ducts inside a factory where every drop of fluid produced needs to move smoothly and be released properly. However, once we reach the age of 60 and beyond, many factors such as changes in aging hormones, a sedentary lifestyle, feelings of embarrassment, or simply a lack of knowledge can reduce the effectiveness of the prostate's natural cleansing process. As a result, the ducts inside the prostate begin to accumulate old fluid, dead cells, and biological residue. It is similar to a garden hose that has not been used for a long time. The water inside becomes stagnant. Algae and debris form, and eventually the flow becomes blocked in the prostate. This condition is called glandular fluid congestion, a phenomenon that urology experts warn is very common among older men. When fluid builds up excessively, the internal pressure rises, causing a heavy, tight feeling in the lower abdomen and directly affecting urination. You may notice that you urinate multiple times at night, have a weak stream, experience difficulty starting, or feel like your bladder does not empty completely. These are not just minor inconveniences. They are signs that the factory inside your body is under too much strain. Over time, if this condition continues, the prostate can become chronically inflamed or enlarged, severely affecting the urinary system and your overall quality of life. What is concerning is that many people choose to stay silent or accept this discomfort because they believe it is just a part of getting older. But the truth is, the prostate does not weaken because of age. It simply responds to what you fail to do for it. If you do not help it release what is stuck inside, it will bear the pressure on its own and gradually lose function. On the other hand, if you establish a consistent care routine, just like performing regular maintenance, the prostate will operate smoothly and support your entire physiological system more effectively. Throughout more than 20 years of working with older adults, I have realized that one of the most misunderstood topics is how to care for the prostate. Some people believe that after retirement, they no longer need to pay attention to that part of their body. Others feel that focusing on this area of health is too personal or something that should not be talked about. But the truth is, the prostate, just like your teeth, heart, or joints, needs regular maintenance if you want to stay healthy and avoid unnecessary discomfort. So, what does maintenance mean? In this case, it means creating a gentle and consistent habit that allows the prostate to be naturally cleansed, reduces internal buildup, and improves blood circulation within the gland. By maintaining this habit 2 to 3 times per week, you help your body release pressure, reduce excess hormone accumulation and old fluids, and lower the risk of enlargement or inflammation. In fact, many studies from Harvard University and the National Institute on Aging have shown that maintaining natural physiological activity at a moderate level can help the prostate stay flexible, reduce the risk of cancer, and even improve sleep quality. In my practice, I once worked with a patient named Ronald, 68 years old, a quiet and reserved man. He often had trouble sleeping because he had to wake up 3 to 4 times each night to urinate. After receiving some advice and making a few small changes in his personal habits, he returned 2 months later with a gentle smile and said, "I never thought such a small action could make such a big difference." What I want to say here is not to encourage you to do anything that feels outside your comfort zone. Instead, I want to remind you to give your prostate a chance to recover naturally. Through gentle actions your body was designed to carry out. This does not cost money, does not require medication, and does not need anyone's help. All it takes is a little time for yourself in a private, quiet, and relaxed space. It is not something strange, and it is certainly not something to be embarrassed about. On the contrary, it is an important part of how you take care of your hormonal and urinary health as you age. And when you treat it as a natural part of your self-care routine, just like brushing your teeth, drinking water, or going for a walk, you will notice your body responding in ways that might truly surprise you. If you have ever wondered why the prostate becomes more prone to enlargement or dysfunction after the age of 60, the answer lies in a hormone called DHT, short for dihydrotestosterone. This is a natural byproduct of testosterone, which is the key hormone responsible for the distinct physiological traits in men. During adulthood, DHT plays an important role in developing the prostate and other male-specific organs. However, as we age, the body continues to produce DHT. While its ability to process or use up the hormone gradually declines, this situation is like having a small engine that can only handle a limited amount of heat. If you keep adding hormonal fuel without giving it away to cool down or regulate, the engine will eventually overheat and become overloaded. In medical terms, this manifests as benign prostatic hyperplasia, meaning the prostate enlarges, presses against the bladder and urethra, causes difficulty with urination, increases nighttime bathroom visits, and reduces natural vitality. According to the American Urological Association, AUA, more than 50% of men aged 60 and older show signs of prostate-related issues caused by DHT imbalance. So, how can we help cool down this hormonal engine? One of the most natural and safe ways is to allow the body to release excess hormones through regular, gentle physiological activity. When you maintain a consistent personal care routine, your body activates a reset-like mechanism that helps temporarily reduce DHT levels in the bloodstream, lowers hormonal pressure on the prostate, and gives the gland a chance to rest, recover, and maintain its healthy size. Several studies published in the Journal of Urology have also shown that regular light physiological activity is associated with improved urinary function, lower PSA levels, a biological marker of inflammation or prostate enlargement, and better sleep quality. This means you are not only cooling down the hormonal engine, but also helping the entire system operate more smoothly and comfortably. And most importantly, you do not need to understand every complex biological formula. Just remember this: your body has a very intelligent natural regulation system. What you need to do is simply support it with the right habits. In the next section, I will share with you the true story of two men of the same age who ended up living completely different lives simply because of one small choice in how they cared for their hormonal health as they aged. A few years ago, I had the chance to see two male patients in the same week. Both were over 60 years old, had similar physical conditions, lived in temperate climates, did not smoke, and had already retired. But the difference lay in how they took care of their physiological health, and that alone created a noticeable contrast that even they did not expect. The first man, named David, was 67 years old. He came into the clinic feeling tired and often woke up in the middle of the night to urinate. He frequently felt like his bladder was not completely empty. When we performed an ultrasound and tested his PSA levels, the results were higher than normal, indicating that his prostate had started to enlarge. When asked about his lifestyle, he hesitantly admitted that he had been neglecting his physiological care for a long time, thinking it was no longer necessary at his age. He also shared that he often felt low on energy and like he was no longer himself as he used to be. In contrast, a few days later, I examined another man named Michael, 66 years old. He was cheerful, alert, slept well, and rarely had to wake up at night to urinate. His prostate exam showed new problems. His PSA levels were within the safe range, and his urine flow was strong and healthy. When asked about his habits, he explained that he continued to maintain regular personal care several times a week, viewing it as part of his overall health routine. To him, this practice was nothing to be ashamed of. It was a way to show care and respect for his own body. From these two stories, I realized something very simple. The difference in health after age 60 does not only come from genetics or financial conditions. It mainly comes from whether or not you truly understand and listen to your body. A habit that may seem small can actually help keep the prostate stable, allow you to sleep deeply, urinate more comfortably, and maintain clarity and confidence in daily life. The prostate, like any other part of the body, not only needs to be cleansed, but also nourished with fresh blood and nutrients to maintain long-term health. But few people know that the very process of releasing old fluid, when done regularly, properly, and naturally, can trigger a chain of biological reactions that help regenerate the cellular structure inside the prostate. It is similar to wiping a dusty window clean so that light can shine through more easily. Each time the body performs this cleansing activity, the small muscle fibers around the prostate contract in a controlled rhythm, like gentle pumps, helping to push out old fluid, dead cells, and accumulated debris. This is not a random event. It is a built-in biological response designed to keep the system running smoothly. When the old fluid is released, more fresh blood is drawn into the area, carrying nutrients and oxygen, both of which are essential for nourishing and repairing prostate tissue. A study published in the Journal of Clinical Urology confirmed that maintaining moderate physiological activity in middle-aged men increases local blood flow to the prostate, supports tissue repair, and reduces the risk of chronic inflammation. This is a significant discovery, as many people believe that cellular regeneration can only happen through medications or medical interventions. But our bodies already have the ability to heal as long as we give them the right conditions to do so. In my clinical experience, I once worked with a patient named Arthur, 70 years old, a retired carpenter. He shared that since his wife passed away, he had almost completely stopped caring for himself in this way. Over time, he began to experience a weaker urine stream, poor sleep, and unexplained fatigue. After receiving thorough guidance, he began reestablishing this gentle routine, combined with walking, proper hydration, and eating hormone-supportive foods. After just 6 weeks, he returned for a follow-up with significantly improved prostate results. But what touched me most was the look in his eyes, brighter, steadier, as if he had found his way back to himself after being lost for a long time. Arthur's story shows that caring for the prostate is not just a physical task. It is also a way to reconnect with your own body. When you take action, you are sending a message to yourself: I still care. I still want to be healthy. I still want to live better each day. And your body, in its miraculous way, will respond to that care with positive signals from deeper sleep, easier urination, to a renewed sense of inner vitality. We have just gone through a gentle but very important journey together, a journey to rediscover how the male body functions after the age of 60, especially the prostate. You have seen that just one simple action, maintaining a regular and natural self-care routine, can bring about 3 surprising changes: cleansing the prostate, reducing hormonal pressure, and supporting cellular regeneration within the gland. No medications, no expensive equipment, no one else needed. Just you and a bit of patience, a bit of understanding for your own body. We often wait until symptoms become obvious before we worry, but the body always whispers long before that: nighttime urination, weak stream, poor sleep, and low energy. These are not things you must endure because of aging. They are gentle reminders that it is time to start paying attention again. And you do not need to begin with something big. Just one small action each day, like changing how you care for your prostate, or simply drinking a warm glass of water before bed, can lead to meaningful changes in just a few weeks. If you found today's content helpful, please click like so I know you are interested. Leave a comment to share your thoughts or ask any questions you may have. I read every message from you and will respond in upcoming videos. Do not forget to subscribe to the channel for more content on herbal remedies, nutrition, and exercises that support hormonal health, urinary function, and sleep in your later years. What methods are you using to support your prostate health? Share them below the video so others can learn from your experience. And if you have a loved one who is facing similar issues, please send them this video. It might be the most valuable gift of health you have ever given.